I was able to watch Workish treat patients, and I also had the opportunity to have him work on me. The process appears simple. The fully clothed patient stands erect, and Workus moves about the patient, keeping his hands a few centimeters away from the body surface. He appears to be almost in a trance state. His eyes are open but appear unfocused, and he has a peculiar respiratory pattern of short, audible, regular breathing. The process takes less than 10 minutes. When I was the patient, I shut my eyes so that I would not know where Workus' hands were. I wanted to determine whether I would experience any sensations during the procedure in any particular area of my body, without being influenced by my knowing where he was working. On several occasions, I noted distinct feelings of warmth and tingling. Each time, on opening my eyes, I found that the sensations were located near the position of Workus's hands. Immediately following the procedure, I felt his hands. They were distinctly cool and did not produce a feeling of warmth on my skin. Workus had no knowledge of any of the diseases that I had. I have a minor arthritis in my hip joint, a mild spastic colitis, and rather severe glaucoma with loss of 70% of the visual field in my right eye. On examining me, he diagnosed mild arthritis in the right hip, stated that I had some problems with my colon, and told me that the energy level on the back of my head was very low. While he found no problem with my right eye, the visual images from the eye go to the visual cortex at the back of the head. In the same session, he diagnosed several other individuals with similar precision. Following my experience, we discussed the possible energetic aspects of his practice. He then described a singular event that reinforced the likelihood of such aspects. Before coming to the United States, Workus and his wife had demonstrations of healing at various cities in Poland. One evening, they were in a small city using the stage of the local theater. The patient sat on a chair on the stage with Workus standing next to him. Mrs. Workus was seated at a table, also on stage, about 50 feet away. She had a microphone with which to explain to the audience what her husband was doing. The stage lights were located on the ceiling over the first row of seats. With the control box located in a cabinet at the side of the stage, the first three patients had simple depressive neurosis, which were easily treated, but the fourth case was a patient with cancer. Because it was evening, the stage lights were on, but those in the rest of the theater were off. About 15 minutes after treatment of the fourth case had begun, Mrs. Workus had noticed that the lights appeared to be slowly pulsing and that this seemed to be producing waves of light over the front row of seats and the stage. The pulsing increased in intensity and frequency, and it was noted by the audience as well. The microphone had begun to pulse at the same frequency, and Miss Workus pushed it away from her. Stir in the audience and his wife movements caused Workus to stop the treatment, and the lights and sounds suddenly returned to normal. The theater electrician who had been in the audience came rushing up, asking, "What have you done to my lights?" This was the only time such an unusual event had occurred during a treatment, and the only time that this particular stage lights had behaved in such a fashion in that theater. Using a frequency generator and a speaker, I was able to have Workus and his wife determine the frequencies involved. They both felt the oscillations had begun at about 1 hertz, increasing in strength and frequency to about 4 to 5 per second, 4 to 5 hertz, at which time Mrs. Workus pushed the microphone away and the session terminated. It is, of course, impossible to determine what exactly happened, since all of this occurred several years ago and many miles away. However, we can speculate using knowledge of how stage lighting was done some years ago. The main requirement for stage lighting is that it be smoothly dimmed to full darkness and be able to be brought up to full brilliance in the same fashion. In those days, this could not be done with the standard AC power system, and stage lights used a DC supply that would be slowly dimmed. If the theater had such a system for stage lighting, it's possible that Workus gave off a slowly varying electromagnetic field that was strong enough to produce a modulation of the DC supply to the lights. From a physics and engineering point of view, this is the only tenable possibility, and this observation lends some support to theory that the healer phenomenon directly involves electromagnetic energy. Recently, there has been firmer substantiation of this theory through some experiments done in mainland China. The healer technique in China is called Qigong or Qigong, depending on which district in China that is involved. The method is more spectacular than that used by Workus. The Qigong master stands several feet away from the patient, makes certain classical formalized movements of his body and arms, and then points his outstretched arm at the patient. The Chinese believe that the master acquires qi energy by means of these movements, and that he then projects that energy towards the patient, who is considered to be deficient in qi, or else has two components of qi imbalance. While to the Westerners this may sound like nonsense, this therapy has, along with acupuncture, persisted for many thousands of years in China. Qigong practitioners are also often called upon to treat animals, apparently with considerable success. Given the details of the treatment, the only defensible possibility is that there is a transfer of electromagnetic energy from the Qigong master to the patient. In this case, what is the purpose of the stylized movements that are considered so important to be therapy? Dr. James Ma, professor of physics at the Chinese University of Hong Kong, has made an interesting suggestion. He postulates that these bodily movements are in the specific frequency range at which the proton, the nucleus of the hydrogen atom that is so common in water molecules of the body, will absorb energy from the Earth's natural magnetic field by means of nuclear magnetic resonance, NMR. Because the concept of electronic resonance is so important to the understanding of the relationship between living organisms and electromagnetic fields. It will be discussed in detail later in this book in chapter 10. To explore the relationship between electromagnetism and the Qigong phenomenon, doctors at the Huzhong Normal University in Wuhan, China, used NMR in an attempt to determine whether Qigong masters give off any electromagnetic radiation. They studied the effect of Qigong treatment on the complex bioactive or organic phosphorus-containing chemical ON propyl O alethiophosphorymide. This particular chemical was chosen because it produced a well-characterized NMR spectrum in its normal state. However, if exposed to a low-strength EM field, the chemical would absorb the energy, and certain atomic bonds in its structure would be altered. This change would result in a specific recordable change in the NMR spectrum. The extent of the change in the NMR spectrum indicated the amount and the site of structural change in the chemical molecule. This changed molecular structure would persist for several hours after exposure of the chemical to the electromagnetic field. In the experiments, the chemical substance was enclosed in a sealed glass container, and Qigong masters were asked to treat it, holding their hands a certain distance away from the container. The NMR spectrum was reported before the treatment and found to be normal. Following the treatment, the NMR spectrum changed significantly. The extent of the alteration in the NMR spectrum could be increased by repeating the Qigong exposure. Similar studies are ongoing in the United States at this time. However, only preliminary results have been obtained. These studies are models of the type of rigorous, objective scientific investigation that should be done in regard not only to the healer phenomenon, but to many of the other techniques of energy medicine as well. The conclusion that may be reached from the Chinese studies is that the healer phenomenon has a basis in physical reality and that some form of electromagnetic energy is unquestionably involved. The results indicate that the healer gives off electromagnetic energy from his hands during the treatment process. It is essential that we determine the strength and the frequencies of the field produced by the healer. An extremely useful device for this would be the squid magnetometer, the very sensitive magnetic field detector that made it possible to discover the magnetoencephalogram. While it is possible that the extremely sensitivity of the squid is not required, its accuracy and ability to measure both DC and time-varying magnetic fields makes it the best available. Unfortunately, the price of a good squid is about $75,000. And this does not include the cost of normal upkeep. Since there are a number of such devices in use at various academic institutions around the country, it could be expected that the interest of science, one of these devices would be made available for a few weeks necessary to complete this type of study. Unfortunately, this has not been done, despite a number of requests. It also might be fruitful to determine those frequencies of the magnetic field to which healers are particularly sensitive. It may be possible to produce a spectrum of sensitivity that might indicate that different diseases produce specific frequencies and that these are sensed by the healer when he makes the diagnosis. If this should prove to be so, one could use this finding as a basis for designing diagnostic devices that would support or even bypass the healer for diagnosis. Workus may thus be cooperated in the ultimate demise of his technique, but knowing him, I believe he would think it well worth it. The minimal energy techniques, which are based upon activation of the body's innate internal control systems, work. As an orthodox trained physician and board certified orthopedic surgeon, I have absolutely no hesitancy in recommending that patients with life threatening conditions follow this route after they have been given a careful and full disclosure of all the therapeutic possibilities open to them. In my opinion, the use of these techniques only as a last resort after orthodox treatments have reduced or destroyed the patient's own resistance systems is probably much less effective. I try to follow one primary rule: make sure that the patient knows all there is to know about the illness and the therapeutic possibilities, but both orthodox and unorthodox. Then the patient must make his or her own decisions. The only problem with the minimal energy techniques is that present we know so little about mechanisms involved that we are unable to increase the efficiency or treatment or to shorten the time required for most such techniques to be effective. A patient who is determined to follow minimal energy techniques to deal with a life-threatening illness must know that while this course of treatment may be successful, it requires the expenditure of large amounts of time. Despite being convinced of the efficacy of these techniques, many busy people simply cannot follow such a course. Recognition of this problem has led to an increased interest in techniques that involve the administration of artificially generated electrical or magnetic forces so that the internal control systems can be influenced immediately. These techniques will be our next topic. Chapter 5. Building up the body's electrical system, energy reinforcement techniques. The cell is a machine driven by energy. It can thus be approached by studying matter or by studying energy. Albert Szent-Györgyi, Bioelectronics. We have seen how the body's internal energetic systems may be accessed by the conscious mind through the use of several techniques that do not involve the addition of any external energy into the body. The body's internal energetic control systems are subtle and they operate with minute amounts of electromagnetic energy. A little goes a long way, and very often more is not better. In the field of energy medicine, we would do well to follow the old aphorism to assist rather than replace nature. Much commitment and enthusiasm will obviously be required for a successful transition from technological medicine to energy medicine, but our enthusiasm must be tempered with prudence and based upon knowledge of how such techniques work and what their potential side effects may be. It is evidence from the preceding chapters that the electromagnetic forces lie at the most basic levels of living things, and that this is an area we should enter with caution. This chapter will deal with those techniques that appear to work by adding to or reinforcing the existing internal energetic systems through the application of small amounts of external energy. While these techniques introduce external energy and are therefore potentially more dangerous than the minimal energy techniques, they are less dangerous than techniques that employ the same forces at magnitudes that overwhelm the internal systems. Again, I will limit my discussion to those techniques with which I have had personal experience and that have the theoretical capability to act via electromagnetic forces. Homeopathy and the law of similars. If body energies are subtle, then the subtlest active treatment involving energy has to be homeopathy. This concept of medical therapy actually began in the early 1500s with Paracelsus, a law of similars, which postulated that one could cure symptom by giving very minute quantities of a medication that would produce the same symptom in large doses. At that time, this symptom-oriented approach to medicine was perfectly acceptable, since causes for diseases were unknown. We can only speculate that Paracelsus based his idea on his intuition on the subsequent experimentation. It remained for Dr. Samuel Hahnemann to organize this concept to a coherent system of medical practice more than 250 years later. Hahnemann published his major work, Oregon and on the a rational basis of healing in 1810, at a time when chemistry was in its ascendancy and medical prescriptions were lengthy and complex and often included large doses of toxic drugs. Hahnemann's prescriptions, consisting of extremely small doses of single preparations, greatly simplified medical practice and attracted a large following. Homeopathy was quite popular during the 19th century when it served as harmless alternative to purging, bloodletting, and toxic drugs popular among the physicians of that time. Hahnemann organized homeopathy by developing the method of provings in which he investigated the psychological effects on normal human subjects of large doses of many different natural materials. In this way, he built up his Materia Medica, a compendium of symptoms and the minute doses of remedies that cured them. In modern homeopathic practice, a lengthy interview is an essential element. The physician tries to evaluate the totality of the patient and his or her reaction to the agent that is presumed to be causing the symptoms. Even though many homeopathic remedies have the same purported physiological effects, the homeopathy physician tries to select the precise one for each patient's psychological type. This is in accord with Hippocrates' concept that the symptoms of each disease are a combination of the causation agent and the patient's reaction to it. Such a personalized type of therapy must contain a large element of the placebo effect. Modern scientific medicine, on the other hand, is disease-oriented. Therapeutic agents are selected solely on the basis of their antagonistic action against the disease-producing agent. This concept originated as science began to identify those outside agents, such as bacteria, that were causes for disease. In the case of infectious disease, this had been remarkably successful, starting with aseptic surgery and then moving to the public health measures concerning contagious diseases. More recently, antibiotic therapy for established infections changed medicine from an art to a science. However, with the advent of internally produced degenerative diseases, the application of this simple causal relationship totally neglects Hippocrates' idea. Homeopathy is the other side of the coin. Being symptom-oriented, it concentrates its attention primarily on the body's reaction and neglects the causative agent. Technological medicine and homeopathy accuses each other of lacking an appropriate scientific basis. Since technological medicine has been so successful in the past, its pronouncements of scientific authority carry more weight today. It considers the clinical evidence for the effectiveness of homeopathy to be anecdotal and solely the result of placebo effect. This criticism is reinforced by Hammond's technique of multiplying dilution his preparations, which was so drastic as to appear to be absurd. He arrived at solutions in which no trace of the original medication could possibly remain. To complicate matters, Hahnemann also subjected each series of dilutions to succession, a mechanical agitation produced by banging the container of medication on a tabletop a certain number of times at each dilution. In Hahnemann's term, the mechanical agitation potentized the material or made it more effective. Homeopathic preparations are thus characterized by the extent of the final dilution and the amount of mechanical agitation, with greater dilutions and more mechanical agitations resulting in more potent medication. Chemical scientists believe that not only are dilutions so great that no trace of the active agent remains, but also that the mechanical succession has absolutely no effect on chemical species. Finally, the homeopathic remedies were, in chemical terminology, poorly characterized. The actual preparation of most such remedies involved chopping up an entire plant roots and all, soaking it in alcohol for a number of weeks, and then subjecting the alcohol extract or mother liquor to the dilutions and successions. Obviously, even in low dilutions, this solution contained literally thousands of different chemicals. Therefore, in the rush to the base medicine entirely on established scientific principles, homeopathy was decreed to be just so much hogwash. The only problem that with that judgment is that homeopathy works well enough clinically that despite savage attacks by scientific medicine, it has survived. Its survival can be attributed in part to the safety of homeopathy compared with bleedings, purgings, and toxic medications of the real medicine of the 1800s. However, this cannot be the whole story. The practice of medicine depends to some extent upon the pressures of the marketplace, and homeopathy must have been sufficiently useful to retain a market position until today. While those physicians who practiced it insisted that it worked, the scientific physicians decreed that its use as preventing a patient from obtaining proper treatment. Yet anecdotal reports abound attesting to the fact that orthodox physicians often refer not only their difficult cases to the homeopath, but members of their own families as well. Despite all the theoretical objections in the world, homeopathy often appears to work. Over the past decade, there has been a marked upsurge of interest in homeopathy, with increasing numbers of scientifically trained physicians beginning to learn the techniques and actually use them in their practice. As a result of this increased interest, there have been a number of attempts to place homeopathy on some sort of scientific footing. A truly scientific evaluation of the clinical effectiveness of homeopathy was not done until 1986, when Dr. David Riley and his co-workers at the Glasgow Homeopathic Hospital reported in the prestigious British medical journal Lancet on an impeccable double-blind study on the efficacy of a homeopathic preparation for hay fever compared with an ineffective placebo. They reported that the homeopathically treated patients showed a significant reduction in patient and doctor-assessed symptom scores. In addition, they found that the significance of this response was increased when results were corrected for actual pollen counts, and the response was associated with having of the need for antihistamines. Obviously, the homeopathic preparation had a definite physiological effect that cannot be completely explained by the placebo effect. This occurred despite the fact that the medication was diluted to a point in which, theoretically, none of the original medicine remained. The publication of this paper elicited a storm of letters to the editor, which were interesting for what they revealed about the mindset of the modern scientific physician. Despite the studies having been an exceptionally well-planned and well-executed scientific evaluation, one writer called it the first randomized double-blind of a trial of one placebo against another, and went on to state that the homeopathic potency used contained not one molecule of the original extract. The objection raised by the critical letters came down to the one point. Homeopathy simply cannot work. If the results of a scientifically valid study are at a variance with established theory, the study must be incorrect. The idea that one should consider revising the theory was not mentioned except by a few correspondents.